disease surveillance and response. So please remember the PIDSR. The PIDSR was actually mandated by a law. So please remember that PIDSR is the Philippine Integrated Disease Surveillance and Response. Remember what I was telling you last time, guys, when it comes to um reporting of diseases, like for example one in Zamboanga, and then it will be reported to the DOH here in Manila, the main. So it's actually through the help of your PIDSR. Okay, your PIDSR, all the diseases are actually in here. Okay, so be it communicable and non-communicable diseases, they are all in here. The HRIS, the Human Resource Information System that we were talking about a while back, ayan, it talks about the compensation, the training. So technically, what I want to give you out on the HRIS is that in the Human Resource Information System, all the processes are integrated in one system. So all processes that concerns administrative um, administrative issues will be on the administrative system. Everything that needs everything about the laboratory is in the LIS. Everything about HR, compensation, the payroll, it's all in the HRIS. So you see, in the help that is being given to us by health information system is that it integrated everything on one system, more like your phones. So I am guessing that most of us are actually are already having our smartphone. And your smartphone is a calculator, a camera, a music player, a radio, uh, a you can do message there. It's a telephone. You can do calls. You can watch movies. You can watch Netflix. And I hope you did watch the Bly Manor. It's good. And then of course, aside from that, okay, before, you need to have all those gadgets, all those machines and devices for you to be able to do everything that you want to do. But with the smartphone, okay, with the smartphone, and tomorrow, by the way, is the Apple event already. Okay, who's excited? So tomorrow will be, ay tomorrow tuloy. Those smartwatches got everything for you. Okay? They have everything for you. Much more like your health information system. Are we clear? Clear tayo doon? Your health information system also gives you information about the demographics, about what is the mortality rate right now, the morbidity of this particular disease, what are the medications, what are the allergies, everything literally. Later, when we go to the data, it are all included in the health information system. So in addition to that, we also have district surveillance system. So take for example here in Pasig City. So you have all the barangays in Pasig City, and then you will be able to just click it, and then you'll be able to see how what is the level of or what is the mortality and morbidity of COVID-19 in that particular area. In addition to that, we also have this hospital patient administration system. So take for example, we do have a new patient. So they will all be registered in the hospital administration system. So their name, their address, everything about them, it will be entered there, and then it will be forwarded into other it will be forwarded into other systems. That's why, remember when we were talking about health information exchange, so that is an exchange between one system and to another. Okay? So more like an exchange from take for example, from the hospital information system going to the PIDSR. So those are the exchanges that we were talking about. In the laboratory, okay, let us go now in the laboratory. Okay, in the laboratory, we have here your BizBox. Okay, we have here your BizBox. I don't know why is it cover. Bakit nag-overlap yung pictures on my side right now? But this is the hospital information system. Okay, in the hospital information system, we do have the informations. We do have the what do you call this? The different tests, the different procedures, and even the different doctors that needs to attend to that particular patient. So more like the Grey's Anatomy moment, it's like that. The laboratory information system, on the other hand, on the LIS, this will give us a picture. Okay, this will give us a picture of the things that are to be extracted to that particular patient, the different tests that we need to collect from them, okay, and the different tests that we need to do on their specimens. We also have this material management system. So as you can see, everything is organized. So when you take out something, when you take out a supply, you will actually be um, doing a barcode, or yeah, you will just be scanning a barcode before you release a particular material, and then it will automatically be on the inventory. So you see, guys, the health information system, the information systems in general, actually eliminate much of the clerical, or the hands-on, or the personal na pagbabantay ng mga tao. Why? So aside from actually limiting the number of people, it would actually also enable us to what? To increase efficiency on the human resource services. So yung mga services, the health services that they are providing, it will actually be optimized because they will not be busy. They will not actually be consuming their time doing the counting of specimen, the counting of test tubes, because all of those things will be done by your material management system. Which leads me now to the ultimate role of your health information system, the role and its function. Okay, its role and its function. So first and foremost, sabi nga natin dito, what is its role? What is its role? And actually, what is um I would say that this is actually more like their benefit, okay? More like the benefit that our health information system is giving us. So the role and a function of HIS is first, easier access to files. So I cannot overemphasize this anymore. We've been talking about HIS since, I don't know, during the prelims. So easier access, and I have given you sort of examples before, that whenever a particular patient would come in, take for example, 5 years or a year or a month after their result or their test has been done, it actually would accumulate a lot of papers already, a lot of results. But because of the health information system, because of all this because of all the systems that we have been talking about a while back, okay, we are now able to easily access all the informations. What else? Better control. So when we say better control, it only means that I think it was a question last meeting. Okay, it was a question last meeting. So better control. Not everyone can actually access all the things that are in there. Only authorized personnel can have access to the information of your patient's health. The doctors are the only one given permission to like update the patient information. But yeah, still, sabi nga last time when some of your classmates were asking, sure, what if they change it? Okay, that will now be the liability, the responsibility of those, of course, having that account. Okay, having that account. But let us just look into the brighter side about this. It's because better control, meaning, take for example, especially right now, especially right now here now in the pandemic, most of the things are actually remote. Like our classes right now, it's all online. It's remote, and you need not to go to, like, you need not to go to banks anymore. You need not to go to hospitals to get your checkup. You don't need to go to like the school anymore personally. So that's actually one thing that's health information is providing us naman on the health sector, because better control, meaning they will able to access, they will able to manipulate all the things that needs to be done, even if they are not really on that certain place. In addition to that, we also would have easier update. So take for example, it's as simple as like tweeting. It's as simple as posting your status on Facebook. Simple as sending a direct message or a PM. Okay, as easy as that. So we'll be able to like manage the information of your patients. You can like access the medical history, you can update it,